So it might be a little bit late in the day to start throwing some definitions out there, but what I want you to get from all of the talks here today is that patterns really reflect whole foods, but it's not just foods. It's how they're consumed, when they're consumed, with whom they're consumed, it's snacking. It's all of these things. It's the totality of exposure. I do want to take a couple of slides to go through the methods because I think that really helps to distill what different research on patterns has found. So basically, there are two ways you can come up with dietary patterns. One is the investigator-defined, and one is data-driven. So in investigator-defined methods, we compare self-reported dietary intakes to some sort of criteria, whether that be an index or a score, so the Healthy Eating Index or the Mediterranean Diet Score. That's not necessarily a pattern, it's how well something adheres to a predefined ideal system. So these are good tools at looking at how diets measure up, but they're not necessarily patterns per se. The data-driven methods are the other major category. First, I'd like to touch on outcome-dependent approaches, which are becoming more prominent, but right now there's not a lot of use of these in the literature, but this is where I think the field is going. So we have an outcome of interest, whether that be heart disease or osteoporosis. We look at that and then we try to look for variation in the diet that explains that outcome. So I have here reduced rank regression and CART. I think you'll see more and more of these types of papers coming up. But really the bulk of the literature to date has focused on outcome independent. So for those of us who are old enough to remember the yellow pages, you let your fingers do the walking. With data-driven approaches, we let the data tell the story. So we do that with cluster and factor analysis. And so just really quickly, cluster analysis groups people together, and factor analysis groups foods together, and both trying to explain variation. So with cluster analysis, you're in a group or you're not. This side of the room is Western, this side of the room is prudent. With factor analysis, every single person in this room gets a score on how well they identify with a certain pattern. So keep that in the back of your mind as I'm showing you some data and some examples here today. The strengths of looking at dietary patterns is that we just don't eat nutrients, we eat foods. And foods are complex, there's lots of things in foods, many of which are collinear. Not only from a nutrient perspective, like calcium and vitamin D travel together, but also certain foods travel together, like macaroni and cheese or cereal and milk. So understanding the totality of exposure is a real benefit of a patterns approach. And if you were at our session yesterday on the errors in dietary assessment and how 24-hour recalls underestimate energy exposures, one of the papers that I worked on way back when I was a student was looking at the impact of that energy underreporting in dietary patterns. And as it turns out, despite the errors of energy underreporting, the patterns are pretty well preserved, whether people were underreporting their energy intake or not. So I consider that a strength of this type of approach. There are some limitations, and I think that the previous talk really is the perfect example for how what I consider to be a prudent diet is different than what someone in an Asian country would consider to be a prudent diet, but we use those same words because they're named by the researchers. There's really no definition for what some of these patterns that are commonly used reflect. The differences in the intakes of foods might be small. There might be different patterns, but that might only be different by a half a serving size or one serving size for certain food groups. And finally, some of the issues that I talked about previously with factor and cluster analysis both have strengths and limitations in their interpretation. So, what is the typical American diet? Originally, eating patterns in the United States were largely influenced by the cuisine of its early settlers. To this day, there are still distinct eating patterns in the U.S. based on this map that was developed in 1750, such as the Cajun and Creole influence in Louisiana, the Spanish influence in the Southwest, and since I'm from Pennsylvania, I have to talk about the Quaker influence there. So there are some of these cuisines that are still preserved, but yet at the same time, cuisine is no longer bound by geography. Every day we have access to foods from all around the world. Ethnic foods in restaurants are now typical, and our produce and other foods are globally sourced. So in short, the American cuisine is one that can be best described by variety, and I think that's something that each and every speaker touched on today. There is no one pattern based on where you live. I'll tell you what is not naturally American. I think that's the best way to start. Dietary approaches to stop hypertension. So this is an intervention trial that has 8 to 10 servings of fruits and vegetables a day. This is not a typical American pattern, but when applied to American populations, we have seen a lot of health benefits: hypertension, reducing cholesterol, reducing risk of heart disease, and even reduction in diabetes for white Americans. Again, the Mediterranean diet is not inherently American, but when applied to Americans, does have health benefits. Now, I'm going to talk about 4 patterns in this country and try to relate those to health outcomes. The first of which is Western, and when I say Western, these are the types of foods that I am talking about. So this pattern is characterized by refined grains, high intakes of red and processed meats, high intakes of sweetened candy, and high-fat dairy. Prudent, in this context, is talking about a diet that's high in fruits and vegetables, whole grains, legumes, fish and poultry, and low-fat dairy. The other 2 patterns that I'm going to talk about today are Southern, and that is Southern, the region in the United States. And so this pattern is typical of fried foods, processed meats, sweetened beverages, particularly sweet teas, eggs, and added fats. And finally, a vegetarian pattern. And vegetarian means different things, so we'll talk about some of the variations in that, but in general, vegetarian means no meat, but it can have different interpretations in different contexts, and we'll talk about that a little bit. So I'm going to show you a couple of studies from 2 large cohorts in the US. One is the Nurses' Health Study, and one is the Male Health Professionals Study. So these are longitudinal studies where dietary patterns were assessed at different points in time. So I just put this up here by way of background. So the Western pattern is associated with an increased risk of type 2 diabetes in females across all models, and I've highlighted there in red because I realize this is difficult to see. But what I want you to realize is that looking further, it's not just the Western pattern, but it's the association of this pattern and how it's modified by different factors like BMI. So when the Western diet is combined with obesity, we see a substantially increased risk of type 2 diabetes. And as expected, a similar finding was observed for physical activity and for family history of diabetes. I point this out to illustrate that dietary patterns don't occur in isolation. It's not just the pattern that's causing the disease. There's complex interactions that we have to understand with these patterns. Okay, and because Western patterns are generally characterized by high intakes of red and processed meat, the investigators looked at the impact of these different types of foods relative to type 2 diabetes. So for this cohort, total processed meat was associated with the biggest risk of type 2 diabetes. So again, I'm showing you this to illustrate that in some cases, it might be 1 or 2 foods within these major patterns that are really driving the association and not necessarily the whole pattern. Moving on to the male health professionals, overall the prudent diet was related to a lower risk, and the Western diet was related to a higher risk. Again here, what's interesting is that these associations are modified by exercise patterns and by BMI. For example, if you look at the high scores of the Western diet and the low scores of physical activity, you'll see that there's an 11-fold increased risk in type 2 diabetes. Here we go. So these just show you the magnitude. So these are the point estimates here. So shows you comparing the weight here and the pattern score here. These are really nice pointers too. So to summarize the information from these large health cohorts, the Western pattern is associated with increased risk of type 2 diabetes in both males and in females. These associations, however, are modified by weight status, physical activity, and family history. Also, certain foods within these patterns showed stronger associations than others. So whole grains were particularly important among the prudent pattern, whereas processed meats were associated with increased risk in the Western pattern. So now we're going to look at the nurses' health study in relationship to another outcome, coronary heart disease. We see a strong protective effect of the prudent pattern and a negative impact of the Western pattern for total coronary disease. I'm showing you this slide in particular to point out the different effect sizes that can be observed with health outcomes. So while the prudent pattern is protective, the negative impact of the Western diet is much larger in magnitude. So these are some things for you to think about when you're interpreting the literature. This slide looks complicated, but I wanted to use it to make the point that people just don't eat one way or the other. You don't just eat a prudent pattern or a Western pattern, and that can change over time. So this is looking at quintiles of prudent. Would help if I pointed in the right direction. I'm going to lose my vision up here, of prudent versus Western patterns, so that you can see the combinations in this slide of those two and the degree of risk associated with those combinations. So women whose pattern scores were jointly in the highest prudent and the lowest Western had the most significant reduction in risk for coronary heart disease when compared to the opposite profile. Moving on to looking at stroke. Again, we're looking at the nurses' health study here. This is looking at dietary patterns and 14 years of follow-up data looking at stroke as an endpoint. So you can see here, I've highlighted that the Western pattern was clearly associated with stroke, whether that be ischemic or hemorrhagic type of stroke, whereas there was no real protective effect observed for the prudent dietary pattern. Again, upon further inspection of the Western pattern in regards to stroke indicates a substantial effect modification by the presence or absence of hypertension, by BMI, and by smoking status. So the take-home message from this is that a bad diet can be amplified by other factors. So we really need to better understand these types of interactions when we're providing dietary guidance to people. So now we're going to look at weight, and I'm pointing this study out. I'm not going to show you a lot of graphs and figures, but I wanted to make the point that it might be the patterns and the way that they exert their effect on weight status that modifies a lot of these chronic disease endpoints that we're looking at. So looking longitudinally at the nurses' health study, women who had a persistently high Western pattern scores gained substantially more weight than women who decreased their Western pattern score. Similarly, for the prudent pattern, so women who maintained high prudent scores were more likely to maintain their weight over time. So this is very complex when we're looking at things like cardiovascular disease and diabetes that we know are very collinear with weight status. We have to make sure that we're attributing them not only to the patterns, but how patterns might exert their effect on weight status. Interestingly, for both of the large US cohorts, no associations were seen in bone health measures, okay? So for this is for hip fracture. I point this out because some of the other smaller and regional cohorts have found positive associations between patterns and bone health. So remember, it's not just the dietary pattern, but how that pattern exerts its effect in different population groups. Moving on to a different cohort and to a different topic. This is a longitudinal cohort in California female teachers, and they were interested in looking at dietary patterns relative to breast cancer risk and found some interesting associations. So they found 5 patterns, and the top I have highlighted here. First, the plant-based pattern was associated with a decreased risk of breast cancer. But a diet classified by wine and salads had an increased risk of breast cancer, which may seem a little counterintuitive because salads are part of plant-based, but we know that high alcohol is deleterious for breast cancer. So many studies have shown this association between high vegetable intakes and reduced risk of breast cancer. However, what this paper points out is that not all cancers are the same, and the way that the diet exerts its effects are not always the same. So looking further, the associations of these patterns show differential impacts based on the type of tumor, such that a salad and wine pattern was associated with an increased risk, but only among women with ER and PR positive tumors, and that the plant-based diet was only associated with decreased risk for women with ER and PR negative tumors. Okay, so I point this out so that you can see the complexities of patterns, particularly with difficult endpoints like cancer. Next, I'd like to show you some data from the Black Women's Health Study. This is a large prospective cohort of African American women across the United States. Data collection began in 1995, and they have follow-up every 2 years. From this, they also determined a prudent and a Western pattern. And as you would expect, both the prudent and the Western patterns were associated with risk of colorectal cancer in the directions that you would expect. But what's interesting is that the overall findings were being driven largely by women over the age of 50. As I get closer to that age, I was careful not to say older women. So, since we know cancer is related to age, this isn't terribly surprising, right? But this helps us point out that careful examination of patterns across various subgroups and factors should always be examined. Here's another point that I want to make. For pancreatic cancer, I want to look at the importance of looking at the same question in different types of cohorts. So from the large health cohorts that I talked about, there was no association between diet and pancreatic cancer, whereas a population-based case control study in San Francisco found strong impacts of the prudent and Western diet with regards to pancreatic cancer. So the prudent pattern was associated with decreased risk for both males and females, whereas the Western pattern was only associated for increased risk for males. So you can't just look at one cohort and think you have the answer to any of these questions. It could be very different depending on the cohort you're looking at. Moving on to vegetarian diets, I thought it would be best to summarize the data looking at the Seventh-day Adventists. That there's a large cohort in North America. And so this is a religious group that typically is either vegan or vegetarian, and they don't have alcohol or tobacco exposure. So this study has a really large sample size of almost 100,000 people and can help shed some light on the role of vegetarian diets. So, compared to non-vegetarians, vegetarians had a lower risk of colorectal cancer. What's interesting, though, is that no significant association was found for vegans. For lacto-ovo-vegetarians, there was no significant association. But look at this for pesco-vegetarians. So if you are a vegetarian but you do include fish in your diet, there was a significant decrease in your risk of colorectal cancer. And this is one of my favorite things, semi-vegetarians. You know, everybody has one of those in their life, right? You know, I'm a vegetarian, I can't eat that. And then somebody presents like a beautiful steak and they're like, oh, well, just have a little bit, you know. So being a semi-vegetarian doesn't really give you any protection at all for colorectal cancer. So just pick a side and go with it, semi-vegetarians. So there have been a lot of studies looking at vegetarian health, and so I'm just going to show you 2 slides on the meta-analysis of that. So compared to non-vegetarians, vegetarians do have a lower risk of ischemic heart disease, but no significant associations with all-cause mortality, circulatory diseases, or cerebrovascular diseases. But we do see a strong association with the incidence of cancer. And again, this is overall cancer incidence, which I cautioned making big sweeping conclusions about earlier because, again, the differences we saw with pancreatic cancer and breast tumor type. But as an epidemiologist, this to me is a signal. Okay, and it's one that needs a little bit more interpretation and investigation, but this is a signal that vegetarian diets are associated with lower risk of cancer. What's interesting is in terms of bone health, overall bone mineral density was about 4% lower in vegetarians than non-vegetarians at 2 different sites in the body. And they had significantly lower spinal bone mineral density. However, these weren't really clinically meaningful, but it is something to keep our eye on that vegetarians may have lower bone health parameters. So finally, we will wrap up looking at the Southern dietary pattern. So there's really one large study that's looking at area of the South in the US, and this is called REGARDS. So this is a longitudinal population-based study of adults that were 45 years and older enrolled. And they found 5 patterns in the Southern US. And I think this is interesting in and of itself because it helps us see some of the motivations for people's patterns. So convenience. So people that had Chinese and Mexican foods, pizza, and other mixed dishes. People choose patterns for lots of reasons, okay? So these people are choosing them because these foods are quick and easy, not necessarily for cultural reasons or any other reason. Plant-based, sweets and fats, Southern, and alcohol and salads, or as I like to call it, Saturday night. So the Southern pattern is really defined by fried foods, organ meats. Remember I said some of those sweetened beverages. They did a really nice job in getting this information out to the public. So I thought instead of showing you more graphs and figures from the papers, I would just show you the infographics that were created by both the University of Alabama at Birmingham and the Heart Disease. So you can see these are the areas in the US that the study is from, and you can see the health risks and even some, targeted messages, so cut back on fatty foods. I was tired of making slides at this point too, so it was easier for me to just show you these. Aren't these pretty? They are. Okay, so I'm going to wrap up these next couple of slides with just not only summarizing what I've said, but some things to think about when you're interpreting the literature. Interactions exist with these patterns. So I provided a few examples by diagnosis, by type of cancer, by family history. We saw differential effects of patterns by smoking and exercise status. We really don't pay very much attention in this country to why some of these patterns exist. So some of them may be reflective of lower costs or a convenience pattern, as I showed you earlier. So some of these patterns may be a marker for the impact of low SES on health outcomes, as Adam Drunowski would remind us all of. We see from longitudinal studies, however, that patterns in general tend to persist. So if you're somebody that eats one way, over time you're likely to continue to eat that way. And it's important to remember when looking at patterns that they don't always show the same associations in the same cohort. So there's not a lot of take-home messages. If you do this, it will always do that. I mean, that's nutrition, right? That's why we keep coming back, because we're learning and we're evolving, but I felt like I needed to say that. So recent evidence supports the utility of dietary patterns for evaluating the risk of many chronic diseases. And so the Dietary Guidelines Advisory Committee report really spent copious amounts of time looking at patterns in its report. And so if you want to have any more information on US patterns, really, this is an amazing source. And they graded the available evidence as to the strength of it. So for right now, the category is strong for the association of patterns with weight status, and for cardiovascular disease. For diabetes, we have a moderate grade of evidence, and for cancer, really, for breast cancer, there's a moderate amount of evidence for postmenopausal women, but not in premenopausal women, and there's really not enough evidence to make any types of conclusions for lung or pancreatic cancer at this time. So dietary patterns reflect habitual exposure to foods and nutrients, so I think of them as an optimal way to assess diet and disease relationships. As many of the other speakers have said, there is no typical one diet in any region of the world, and measurements of patterns continue for this reason to be an active area of investigation. And so I'd like to leave you with a quote from one of our esteemed colleagues, that we have to think about patterns in our diets along with things like physical activity and the way that we're consuming. Maybe a Mediterranean pattern works because people are enjoying their food. They're not stressed out all the time. There's more exercise. There's so many different patterns of life that go along with these dietary patterns that need to be interpreted in that context. So thank you so much for your attention and really sticking it out. This was the last talk and the last session, and you guys are here, so cheers to you. Thank you.